Hello, guys. Welcome back to another interesting video. My name is Kenny, also known as Nurse Designer, and today we have very interesting guest. When I came across her, I was so happy for having her on my channel. She's going to be telling us the information she knows, or what she knows rather, about nursing associate. A lot of people, we've been hearing about nursing associate. Now I have someone that is going to spill the tea to us now. Is going to tell us what she knows about nursing associate. So please, can you kindly introduce yourself to the audience?
Hi guys, my name is Olayinka, but I prefer to be called Olays. So just as Kenny have said, I'm a nursing associate here in the UK, and aside nursing associate, I have some side also as well. Just like Kenny is a nurse designer, I'm a decorator. I do decorations for events, bridal shower, baby shower, or weddings and all. Yeah, so just like I've said, I'm a nursing associate, and I'm so happy to be here today. It's so good to be here. Thank
Oh,
you for letting me doing this. I'm really
oh, thank you so much. I am really honored. I'm so honored. Thank you for accepting my invitation. Thank you. I would like to ask, please, how did you migrate to the UK? Is it via this nursing associate route or through another route?
I didn't come to the UK through the nursing associate route. So I came in through another route. But when I came into the UK and I saw this opportunity, I was like, wow, this is a good opportunity for me to become a nurse. And it's like this nursing associate route is a route you can use to progress and go on to become whatever you want to be. So I saw this opportunity, and I jumped on it. And because I've always wanted to be a nurse, so when I saw this opportunity, I was like, wow, this is what I would like to do. And then I went for it.
Oh,
Yeah.
good. But if I may ask, please, what route did you come into the UK with? Like,
I came into the UK as a student. So I came into the UK as a student. So after my study and all and everything, I saw this opportunity and I decided to take it.
oh, lovely. Thank you so much. But what made you decide to go for nursing associate? You said earlier that you wanted to go through this route to be a nurse. Like, why didn't
Yeah.
you go to school of to the university to study nursing directly? Why go through nursing associate?
Yeah, because this nursing associate is like is I believe is more like flexible and easier. Though you have to go to the uni, you have to study, you do essays, you do assignments, you do reflections, you do placements and all. But at the same time, you are working and you are getting paid at the same time. And then another thing is you don't really have to, it's not so rigid. Like, I don't know if you understand what I mean. You only have to go to the uni one day a week to study, or then you go back to your base ward where you work with the nurses, you work with the MDTs, that is multidisciplinary team, and then you can learn, you can provide care for patients and all. So it's a really good route, to be honest. So if you are thinking of going into nursing and then you don't want to go for the 3 years at once, so this is a very good opportunity for you to grab. Is a really good opportunity, I tell you.
Thank you so much for that. You mentioned earlier that you get paid
Yeah.
via this route. Like,
Yeah.
are you serious right now?
So yeah, I am. The thing is, this opportunity is an apprenticeship.
Okay.
So yeah, when you are on apprenticeship, you are going to be paid like you are employed full time. It's a full time employment, so you get paid while working, and then you have the opportunity to go to school and then qualify for what you are studying, and then after you qualify, you move up to become what you have been trained for, and then you just keep going. That's it, really.
Wow. So if you want to become a nursing associate now, are you going to apply for to the uni, or you're going to apply for a job? Like, how
No.
do you go about it?
So if you want to become a nursing associate, you just need to go to you apply online. The job role comes as training nursing associate. So
Oh,
so when you apply, then you get, and then you pass the interview, and all you are, they see you are qualified, you've got the necessary qualification, the experience needed. Then if you are successful, from there the your employer will be the one to, like, link you up with the uni. Yeah, you don't have to go to the uni straight up, and you can go to the uni straight up if you want to do it. Yeah, that means you can fund yourself, just like you apply for nursing and then you go to study. Yeah, we have that route as well. But the one I went through is not, I didn't apply to the uni directly. I applied with the employer, and then from the employer, the it was like a link between the employer and the uni. So I'm just like in the middle. Yeah, that's it.
okay. So you have to apply for the job online. When
Yeah,
you get the job, then the trust is going to link you up with the university, and
yeah,
then you start the program.
yeah, exactly.
Oh, so what
That's
are the qualifications that you need for you to be able to be accepted, like from the
um
trust, so that you
it
can go through
it's
this route?
it depends on what is listed in the job qualification, the required qualification. It depends. As healthcare experience, if you've worked in healthcare, like work like healthcare assistant or support worker, yeah, anything health related. And then you need your mathematics and English. Yeah, mathematics and English, just to be sure you are able to, for you to go on to the uni to study, you need the basic skills. So that's one of the basic things. And then you must be caring, you must be compassionate, you must be kind. Just like you can't go into work in the healthcare without possessing these qualities. So those are just the basic things, but it really depends on what the employer wants. So that's it.
If you don't mind, can I actually ask you, how much do you get paid as a nursing associate? When you start the program and then they
Um,
link you up, like how
we
much
get
is the
on
salary like?
yeah, we get paid on the band four.
Oh,
Why?
okay.
Yeah, why as a newly qualified nurse, you are on the band five, but as a nursing associate, you get paid on the band four. So band four payment, it depends on different trusts. Different trusts have their the range for pay for the paying scale. So depending on the trust, but you are on a band four. So,
Oh,
and ranges between is it 24, I think it starts from 24,000 pounds per month to 27 or 28, depending on the trust and depending on how many years you've been practicing as a nursing associate. So then it just goes up that way.
wow. Oh, this is lovely. Like, but how many years is the whole program for?
Yeah, so the program is 2 years. It takes 2 years. You is The program is a foundation degree in nursing. So it takes 2 years. And while doing this program, you do everything required of you to do to become just like nurses. You go to the uni, you go on placement, just like you go on mental health placement, child placement, adult placement, community placement. You get exposures to different areas. Then you've got essays to do, the summative essays, you do essays, do reflection, you do presentation, posters, and then we do OSCE as well. So we need to do OSCE, we do clinical skills and everything, all this put together within the space of 2 years. So after the 2 years, Then we have to do registration with the NMC, just like the nurses, because you can't practice without being a registered practitioner. You have to be a registered practitioner, have your license to practice, and then you are good to go.
Wow, within the space of 2 years, you're working, you're earning your salary, and you are schooling.
Yeah.
Oh, this is it's juicy. It's
Yeah.
too good to be true.
Yeah. It's a very good part, to be honest, especially
Wow.
who who want to make a difference in people's life. If you are caring, and you can be a healthcare assistant and you are able to do this, but if you feel you want to do more, you want to be able to do more for people, to help people on their recovery journey, and to be able to, help people to get better, then this is for you. I promise, this is for you.
Wow. You made mention of some placements that you go to, adults, medical, surgical, different
Yeah.
departments, right? Um, like in nursing now, we have different specialties in nursing. Are there specialties in nursing associates also, like orthopedic nursing associates, adult nursing associates, general, those kind of things? Are there specialties?
um really, I know this, except maybe mental health. As a nursing associate, it's just like a general one. Then when you qualify, where you are working can make you to be to be specialized, or maybe let me say, in the course of your training, where your base ward is, because you have a base ward where you go to every time to work. Right, apart from your placement areas, you've got your base ward. So let's say, for example, you are in a surgical ward for your base ward. Then after qualifying, you feel, oh, I love it here on surgical ward and I want to continue in that part. Then that's it. But really, it's just like a general stuff. Then where you continue to work after qualifying can become your specialty. If you feel that area is for you, if you are working in a pediatric ward and you feel, oh, I love pediatrics and I want to carry on, then you can go for your top up and become a pediatric nurse.
Lovely. During the course of this program, are you going to be bonded by your employer? Like, for instance, oh, they sponsored you for
Yeah.
this particular program, or once you finish, you're going to stay with us for a particular years before you leave us. This kind of stuff.
No, I've never heard of something like that. I don't know if it depends on different trusts, or different trusts, they have their own policy, and but I'm not sure if. But for me, I know for our trust, it's not like that. We don't have something like that. But I don't know about other trusts, if that is what they have in place for their employees or something. I'm not sure. But for me, no. No, after
So,
qualifying and decide to go on to another trust to work, that's fine.
so that means once you are done and you want to go to another trust, are you still going to apply as you're not going to apply as an apprenticeship
Uh,
program anymore, just a
um,
nursing associate directly?
they're going to apply as a registered practitioner.
Oh, that makes sense. That's interesting. So let's come down to the roles. Like, what are the responsibilities, the roles of a nursing associate? Like you said before, like if you want to be a nurse, you have to go through this route. Like, what are their responsibilities? What do they do actually on the ward?
So, as a nursing associate, we let me say we, not you. So, as a nursing associate, we provide patient care. We plan patients care, like doing the care plan and all. We do wound care, catheter care, um medication administration orally, injections, through different routes, except IVs. If some trusts, it depends on the trust, really. Some trusts, nursing associate don't give IVs. But for other trusts, if you want to be able to give IV, then after IV medication, then after qualifying, you have to go for extra training to be competent in that skills. You do the training and a face-to-face training as well, just to make sure you are competent in doing this. And then other things we do is we do, to be honest, is do major has we do like almost all the aspect of patient care, like caring for the patient. You look after your patients, you do discharge paperwork and all. So that's it. Yeah.
Administer medication except IV that you just mentioned, you practically do everything.
Not everything. And then one other thing is that for the nurses focus on complex patients with requiring complex care, while the nursing associates they focus more on patients that doesn't require complex care. So that's the major difference. Nurses focus more on patients with complex care because they've got more experience, they've got more skills, they are really trained for that. But as a nursing associate, it's just is a 2 years course. And for you to become a nurse, you have to go on to the top up course, do the top up course, so you are able to do all the things that the nurses do as well.
Wow, that's really lovely. Like, I would like to ask, are there any career advancements in or career progression in nursing associate pathway? Like,
Yeah, definitely. Just like I said earlier on, you can decide to go for top up top up course. The top up course is about 18 months. That's 1.5 year, and then become a registered nurse if that is what you want to be. And we've got some people as well that doesn't want to go on and become registered nurses. I know people that have been practicing as a nursing associate for 3 to 4 years. Yeah, and they are fine. And one good thing about it is, from as a nursing associate, you can progress on to a band 5, even as a nursing associate. So it's really good. Some people, they don't want to get too much, maybe they don't want to get too much involved, maybe because of, I don't know, it's a personal decision, not just to be a nursing associate and not carry on to be a nurse. But if you think you want to be more, then why not? It's just 18 months. You go back to uni, just to the 18-month top-up course, and then you become a nurse. That's it.
this is lovely. In terms of nursing associates, with your own experience, what
Yeah.
would you say about the demand for nursing associate? Like, do you think there are a lot of demands for them?
Yes. Yes, there are, because even nurses, if you go online and search for vacancies for nurses, is you will always get vacancies. That's just it. And nursing associate as well, you can go on your phone, type vacancies for nursing associates, you will see lots of vacancies. So as a nursing associate, is just the employability rate is really high, just like nurses. It's really high because in the hospitals, in the care homes, in the community, nursing, in schools, in mental health setting, everywhere, anywhere you can see a nurse, then you can see a nursing associate, because we work alongside the nurses. We support the nurses in delivering patients' care. So anywhere you can find a nurse, you can find a nursing associate.
Wow. But how did you hear about this particular pathway? How did you know about it?
Um, I think it was from, let me see. I think I heard it from a friend. Somebody told me about it. There's a particular program. Before then, I've been working as healthcare assistant, and then I'm familiar with patient care, though I don't do much, like what healthcare assistant does, like personal care, feeding, helping with basic needs. So when I saw this opportunity for me to progress, I was like, wow, this is what I wanted to be. I heard from a friend, and when she told me, I said, then this is it. That's what I want to be. And then I went for it.
Wow. I must commend your confidence. Like, so good. But
Okay.
are there sponsorship for this nursing associate route? Like, do they have sponsorship for it? Do they sponsor people?
Like sponsor for visa or
Or
sponsor.
visa? Yes, visa.
No, they don't. I don't know if other. No, they don't. To be honest, they don't. I don't want to be. I don't want to be too affirmative, and then maybe other. Trust. We have different trusts, so I don't. Some trust might sponsor, while others not. But from what I've seen so far, they don't. But things keeps changing every time. We might say they don't today and then tomorrow they start doing so. But for now, as far as I know, no.
So you need to have a stable visa
Yeah,
for you to be able to do this.
yeah, definitely. Yeah.
Oh, so what if you are done with the program and
Mm.
then you are now a nursing associate? Can they now sponsor?
Sure. Sure, they will, because it's a band four role. Most sponsorship with the NHS starts with band three. Most trusts they start their giving certificate of sponsorship from band three, and this role is a band four role, so definitely, yeah. Even if you go online and search for nursing associate, you see at the end of the vacancy and end of the what is it called now, the job adverts,
Advert, yeah.
comes under it that people seeking certificates of sponsorship to work, then it's just there for you. So
Wow, so it's just the initial placement phase or apprenticeship phase that
yeah,
they might not be able to sponsor. But once
yeah,
you are done with the program, they will be able to sponsor.
yeah, yeah.
Ah,
They will.
that's really good. That's a good one. But what would you advise people that would like to go through this nursing associate route? Like, what would you advise them? Do you think it's something they should actually, look into?
Yeah. My, my advice for people who would like to go through this nursing associate role is that for you to be able to do this, you must be kind. Yeah, you must be kind. You just have to do it because it is what you want to do. Don't just say, oh, because I saw somebody doing this and I want to know. Because you have to be kind, you have to be compassionate, you have to be caring, just like the CCs of nursing. You have to be compassionate, you have to have good communication skills. And
Exactly.
yeah, yeah. And then when you are doing this, you are doing it because you really want to do it. Yeah, not because I just want to, let me just try and do this. No, you have to have your patient's interest at heart. You have to be able to provide patient-centered care for your patient, and then that's just it, really.
Oh, this is really nice. I don't
Yeah.
feel like stopping, but yeah, we've come to the end of the interview. Let me say it that way. But guys, there might be some things that we might have forgotten to touch. If
Mm,
you have further questions, just leave it in the comment section, please. I will try as much as I can to get Ole
yeah.
to please come and reply your comments. Just please.
Yeah, so guys, if you have any questions or you need clarification or some things, or you need have something advice on going on this program and all, just drop it in the comment section, just as Kenya said. So I'll try as much as possible to come back and reply your questions. Yeah.
Oh, thank you so much. Oh, I can't just thank you enough. I am so honored. Thank you for accepting to do this. It's been a lovely, lovely, lovely and interesting conversation with you. Thank you so much.